Nursing students, stop second-guessing yourself on exams. Follow Nurse Jean as she teaches you how to pick the best answer on nursing exams. Okay, let's paint the scene. Nurse Jean is working on a med search for today, and her first patient of the day is Miss Betty Sue. Miss Betty Sue is a 57-year-old African-American female with a past medical history of hypertension. She's coming into the clinic today because she's been having a productive cough, hot flashes, chills, and body aches. She states she doesn't feel well. Nursing students, whenever you get a test question with patient data and it asks you for the next step, you should be thinking, should I assess first or implement first? And that will be based off the data that you have in the test question. Following the nursing process. Nurse, remember to choose an assessment answer before an implementation answer, unless your patient is in a life-threatening situation or if you already have enough information in the data in the test question to implement safely. So, Nurse Jean needs to do more of an assessment before she can figure out what to do and how to care for Miss Betty Sue. Nurse Jean reassesses Miss Betty Sue's vital signs. She performs a physical exam focused, and she reviews her most recent blood work, specifically her CBC. So, her vitals show that she's a little tacky at 130, and she does have a fever at 101.4. Her CBC shows that her white blood cell count is elevated at 15,000, and her neutrophils are elevated as well at 10,000, indicating a left shift. A left shift is indicative of an infection somewhere in the body. Remember, when reading labs, context matters. So, after she reviews her vital signs and her most recent blood work, she knows Miss Betty Sue definitely has an infection somewhere due to her left shift. Nursing students, at this point, you should be looking to see if the next steps are actually in the answer choices. And if it is, you would keep that as one of the possible answer choices on your test exams. During her physical assessment, she notices Miss Betty Sue is warm to touch and sweaty, but her lungs are clear. She makes sure she asks additional information about Miss Betty Sue's symptoms. When asking about your patient's symptoms, guys, remember to always ask about those symptoms that pose a threat to your patient's airway, breathing, and circulation. Thinking about the ABCs. After gathering all of the assessment data, Nurse Jean evaluates the data and notices there are some nursing interventions that she can do before notifying the provider. Remember, guys, stabilize the patient first with nursing interventions before notifying the provider. Since Miss Betty Sue has a mild fever, Nurse Jean can administer Tylenol. And you do not administer Tylenol before you check your patient's kidney and liver function. And you would not give your patient Tylenol if they had signs of liver damage as evidenced by elevated AST and ALT. She most likely has a fever from an infection. And when a patient has a fever, their heart rate will naturally go up. That's because fevers speed up your body's metabolism. Nurse Jean places ice packs in between Miss Betty Sue's groins as well as underneath her arms, and then she notifies the provider. Quick check, guys. So, when you get a test question that presents you with your patient's data like vital signs, symptoms, labs, past medical history, and some assessment data, and it asks you what you should do next, you should be asking yourself, do I need to do an additional assessment, or can I safely implement based off the data that I have in this test question? So, Nurse Jean now has enough data to safely implement. She reviews all of her assessment data. When you get a test question with your patient having elevated white blood cells and a left shift, you should be thinking about what tests or imaging that needs to be done in order to confirm the cause of that elevation of white blood cells and that left shift. Like we said earlier, the elevated WBCs and left shift is most likely coming from an infection somewhere. So you should be thinking, what are some causes of an infection? What are some tests, imaging the provider may order to confirm the cause of those infections? How should you instruct your patient or prepare your patient for those tests, including patient teaching as well as nursing interventions? Because it is flu season, the provider orders flu and COVID testing. Miss Betty Sue's flu A test comes back positive. The provider orders Tamiflu. We can give Tamiflu because it's within the first 48 hours, and that's when it's the most effective if given. And guaifenesin, which is not an oral decongestant such as Sudafed, because medications like Sudafed increases your patient's blood pressure, and Miss Betty Sue already has high blood pressure, so it's contraindicated with her. And Miss Betty Sue is safely discharged home. Test prep, guys, this is the critical thinking portion. In this same situation, when would you implement before assessing? If you check your patient's vital signs and her oxygen level was 90%, you will apply oxygen first and then notify the provider. In this same situation, when would you notify the provider? If you were assessing the patient and you found that her oxygen level was 93% and her respirations were 22, even though it's abnormal, it's not critical. In this same situation, when would you call a rapid? If your patient's oxygen level was less than 90% and her respirations were labored, she requires immediate treatment, so we will call a rapid then. So, when taking your next exam and the patient on your test question has elevated WBCs in the left shift, signifying they have an infection, before picking an answer, remember, think to yourself, do you have enough information in the test question to safely implement, or do you need additional assessment data? What nursing interventions can you do to stabilize your patient before notifying the provider? What tests can you anticipate will be ordered to confirm the causes of those abnormal lab results? What are some patient teaching or nursing instructions that should be done in preparation for that test or image that the provider may order? Lastly, how would you know your patient is feeling better based off the assessment findings? Use this same thinking pattern when you're asked to interpret labs on your next test questions, on your next exam, and you'll stop second guessing and start picking the best answer with confidence. Good luck, ladies. And if this helped you, subscribe for more Nurse Jean Clinical Pearls. Bye.